men are made to feel bad for a behavior or expressing their emotion, it's often feminized.
Therapy is not a quick fix. Yeah, for anything.
There is some benefit to the self-fellatio. If you can ejaculate more than a few times a week, it helps reduce the risk of testicular cancer.
It just means that I'm never going to get testicular cancer.
I can't guarantee that, of course.
Yay!
Kia ora.
Kia ora.
Welcome to NOIS.
NOIS.
No one is safe.
No topic is safe. Today our topic is tough guy. This is in conjunction with Men's Health Awareness Month. Shed a bit of awareness on the stuff guys go through. It's always, I don't think they pay a lot of attention to guys' needs and stuff like that.
Yeah.
So that's what we're going to be talking about today.
We're going to be delving deep.
Delve deep. Just a few quick mentions, which we would obviously elaborate on later, and you can click the links below, which with all the attachments for places to seek if you're looking for anything about men's health. We have Anxiety NZ, we have the Men's Shed, we have Movember, and a few more other ones that are in the links below.
We also want to shout out to our sponsors, TUI Medical.
Thank you.
They do an amazing job. They have various clinics around the Waikato, and if you want to join up and become a patient there, it's super easy. They're accepting patients, so phone up, go on in, or log on to www.tuimedical.co.nz.
And now to the man of the hour, moment of the hour. I feel like I'm anticipating this one. We'd like to introduce my friend, colleague, just an all-round guy.
All-round good guy.
Yeah, a few
All
quirks.
That's not a qualification. I am a guy.
Yeah. You are a guy, yes.
With a pulse. This is Dr. Blake Croxford.
Welcome, Blake.
Do you know what? I will let you introduce yourself to the people.
Sure. So my name's Blake, and I am a doctor, and that's a good start. So, I work at the urgent care. That's okay. I work at the urgent care centres, and I've done a lot of ED stuff as well. I think my special interests lie around concussion, and a little bit of post-traumatic stress disorder comes with that as well, and rugby medicine, which I do and will be doing later today.
Yes.
It will be, yes.
So he's on his 0% beer.
Well,
so
not for the first one.
Well,
One's allowed.
He can take a few risks.
Oh, this isn't 0%. Okay, so one beer.
One's allowed. It's not for a few hours.
Yeah. I think our goal really today is just to try to debunk some of the and destigmatize some of these conversations that the societal norms bring around men and how we discuss and manage our mental, physical, and well-being. And we have none other than Blake here to help us guide us. Yeah, guide us through this. He's a statistical man, so bring a calculator.
I think you've oversold that, but sure.
We'll figure that out.
As we go. We're going to kick off and talk about the mental health side first, Blake. So what are some of the common mental health issues that men are facing today in our country, in New Zealand?
Sure. Most of the evidence that I've looked at this point understandably relates to larger countries like the US, but you can largely apply those on a macro scale to New Zealand as well. And I think the biggest ones that we're seeing are anxiety disorders, and that's true both for men and women. Massively prevalent. And then on top of that, for men specifically, you seem to get a little bit more externalization. So you have aggression, so antisocial disorders, and substance misuse disorders. Those are big ones for men. And then yes, there's some depressive. I mean, if you looked at some data, it suggested over the last 12 months that something like 5% of men and 8% and a bit of women met the criteria for a major depressive episode.
Wow, that is I thought wow.
Yeah. I mean, this is again US data, right?
Yeah.
So
it can be blanketed over.
So can it be translated across possibly? And you would think with the large population studies that should be fairly comparable. But of course, New Zealand doesn't have the largest basis of population and therefore doesn't have the largest amount of available data.
And I think a lot of it, again, with those data collection, I wonder as well how many men do actually go and actually say this.
Underreporting is rife, and I think that comes into the suicide figures. So, you know, and again, some of this data is a little bit old, pulled from a while ago, but, you know, even from, I think it was from 1999 to 2016, there was a 30% increase in suicide rates over that period of time.
Wow.
And then when you look at those that had no previous mental health disorders.
Stop matching up.
Yeah, well, it's so you've got about a 50-50 split. 50% of those who commit suicide had previous diagnosed, documented mental health disorders, and then about 50%, or just a little bit less than, had no previous documented mental health condition. Now, in that category, the ones that had no previous documented mental health conditions, that was overwhelmingly male. So that was.
So they're not talking about it.
3%.
Wow.
Yeah, something like that. So it was massively there.
So it's not that they didn't have these depressive episodes; they were just not reported.
Not reported.
Episodes.
Yeah.
I suppose that leads on to. So there's clearly a problem. What do you have any ideas or any thoughts on, like, well, why is this not talked? Is it that it's not talked about? Is it commonly talked about?
I think it's social, right?
Yeah.
As usually, like social pressures, social stigma, a little bit about how we bring up young men, you know, what they're exposed to, both from their direct parents, but also from social media and online and their friends. And a lot of that is that sort of idea of the alpha male, you know, the
like me,
we've
like him, like Tonye, very much alpha male.
Right. Take it all in, guys.
You have to be, you know, you have to be strong, both physically and mentally. You can't ever complain. You have to just get it done. And there's this like breeding of a very competitive atmosphere right from a young age, generally speaking as well.
Even through to, say, some parents who have sons, you know, not allowing them to cry. Or saying, "Oh, don't cry," you know, only wussies cry. It's a weak emotion. Don't do it. And so these poor kids are growing up thinking, "Oh, I mustn't cry. I want to."
A lot of the times, men are made to feel bad for a behavior or expressing their emotion. It's often feminized. And I think that's another issue, is that we associate mental health disorder with females often.
Who aren't as strong, or who aren't
as strong, whatever that means.
Exactly.
Which it generally isn't. I think
no.
Especially from a mental point of view, men and women are the same. They're human beings, you know.
And I think it probably would be fair to say, on average, women probably have better coping strategies as compared to men, because it's sort of built into their upbringing a little bit more, but they also have better social circles and better social support networks.
Girlfriends.
Generally speaking.
I guess what we're saying now is, guys, there is a lot of mental health issues that men do not talk about, and when men moving forward and progressing, therapy is something that is available to everyone, men, women, and I feel like a lot of times even women seem to be very much more open, talking about, oh, I have a therapist, I go to therapy. I can see everywhere. It's become almost kind of normalized-ish, but still within the population of guys, I don't feel like I hear many guys saying, I go to therapy, my therapist said blah blah blah.
Maybe I should work on this.
So what do you feel like? I mean, I feel like society plays a role. I don't know. Like,
well, first of all, I've been to therapy.
Good.
Me too.
So,
High five for that.
That's awesome.
Evolving men.
Yes, I know. I've actually met quite a few men of my age, so sitting at around the early 30s that have...
Our age.
Sorry. Who have done therapy. So I think it is getting better. I think, you know, if I talk to, you know, particularly my parents and people who are around that same age, sort of in their 60s, that's a completely different, like, flip switch, like it's the other way around completely. And I actually think, and I'd need to double check the statistics on it, but I think the suicide rates, yes, young men are a big part of that, but there's actually quite a growing older male suicide rate as well in their 50s and so forth. Although still, I think, you know, disproportionately young.
And again, it's that, I think, just to elaborate a little bit more on therapy, like, how should guys who, they might go to therapist once, I feel like,
it's not for me,
or it's not for me. And it's probably, again, with any tool, there's a way to use it and optimize it. And what would be your views on our advice, really?
I think there's a lot of variables there, right? So I felt a little bit like that with my therapy as well, and I think some people do. And what I usually advise is, maybe this isn't the right fit for you. I think therapy is quite a broad term, and lots and lots of different things can be
come into play
with that. So just because this person hasn't been able to help you as much as you might have initially expected, you just need to go looking around. There will be somebody who will fit what you want and will see the world the way you see it. I think that's one thing. So if you walk into it and you go, this is not helpful, then first of all, I would go through the first round, get through the initial, complete the course, like we say with medicines, take the medications, complete the course of medications. So try it, do it, finish it. And if you still think at the end of that it wasn't for you, then just go find somebody else. And do your research.
And I think that's really, I think that's the thing, again, is trying to, therapy is not a quick fix. For anything. Because a lot of guys don't realize that there's years of damage. It's just like, even if your house has been through the ringer for 90 years, you're not going to get a quick fix to whatever the problems are. That's one. And so I think that perseverance is important. But also, I think guys probably need to understand that therapy is a tool. Like, it's not your Bible or of this. It's meant to, you get the information and you have to apply it to your own situation. Because the therapist is,
with all things, right? When you, especially, when you're 16, maybe this is a bit of a different conversation, but it's difficult to make new connections as you get older. Your brain is a little bit less flexible, a little bit more resistant to change. You've got a lot of embedded bad practices and
you've been taught of
and trauma, and you've got to implement the new strategies, certainly. Often you have to unpick things before you can even start to
put them
direct and tackle them.
Rebuild.
When you've got so much resistance, applying it is the first step, but then being consistent with it is really important, really important bit. And the longer you do it for, the easier it gets. But it can still be a deliberate act for people 2 or 3 years.
Exactly. And it's hard to change habits and to break ongoing habits is a hard thing, and that's why the perseverance, you hit a stumbling block when you're doing that. It's not going to be a walk in the park. You made that decision. There's going to be good days, bad days, good sessions, bad sessions, and it's just sticking with it.
I would say that having a safe space without judgment, partner's not there, friends aren't there, nobody who knows you is there. You're just having an open conversation where you can say whatever you want, whatever you're saying is true or untrue or justified or unjustified, it doesn't matter. You've got a safe space to talk about whatever you want to talk about, and I think that could be therapeutic as well. Because how often can we say things without judgment?
I'm used to being judged.
You are always judged.
Constantly.
The advice is be open. Do your research. I think that's really, really important because there's so many different types of psychotherapy, counseling in an intervention, and not all of it's going to be right for you. You may not know what's right for you, but do your research, give it your best shot, and then if that doesn't seem to fit, then move on to the next one. So do your research.
Cute. Oh, that's awesome. So that's like our little mental health aspect of men's health awareness, but there's also obviously other parts, isn't there, Blake? We as men, we are all-rounded people. We have other issues, not just our brains. We have other parts of our bodies.
We get all the same issues as everyone else.
We do. And that's why we'll go on to this next part, which is a little bit medical. Hoana, you strapped on?
Yeah, for sure. Let's go.
One of the things that differentiates men physically from women, not the penis, Blake, get your mind out of that. I was talking about the prostate. We have a month dedicated to the prostate. So tell us a little bit about, prostate health and when is it important, why is it important, and how do we check this?
Yeah, so prostate health is, I guess, something that I think is probably better known, better talked about than mental health, definitely. I still see a lot of resistance generally, and this is generally observed in men just not seeking out treatment when they know something is wrong. And I think that's probably what would be best to discuss around prostate health. So, you know, there's a couple of things that you might notice when it's going wrong. There's some common stuff, there's some uncommon stuff, there's some not so scary stuff, there's some scary stuff. And scary stuff can't be ruled out until we've fully investigated it. And often it is the not scary stuff. But, you know, that's my motivation if I were to have anything, to then go and get it checked out. So I don't want to have anything scary, I don't want to have anything that's going to get worse. Like cancer. Although in the grand scheme of cancer, prostate's not a bad one to have.
It's a pretty treatable one.
It's treatable, it doesn't tend to metastasize and spread around too early, so it's got a low likelihood of mortality, so death, compared to other cancers. Although it's still got a massive amount because it's quite common, but actually people do live with it and generally die with it rather than
from it. So, Blake, have you had a prostate check, Blake?
Have I had a prostate check? Yes.
Oh.
Yes. Well, I had to because I had to go get a colonoscopy.
Yes.
Yes, because I was having a bit of bowel problems and my poos were a bit.
Good. Oh, so you got
checked.
Yeah, I'm a doctor. I don't care about talking about it.
Yeah.
So I guess I'm going to tell us then how. We're going to be like, I was looking for an edge way to get us into how is the prostate check happening. So because you don't want these guys to be caught off guard who are watching.
Oh yeah, okay. So it's not a pleasant procedure for anyone involved. No, it is not. I think even even though there's talk about pleasure centers around the prostate and all of that, I think nobody and I think this is true for women as well when they have to get intimate examinations. Nobody enjoys a stranger putting a finger up anyway. If it's not, it's just.
That's why do it yourself.
Well, you can.
Is that what you're going to? Or?
No, I was going to say let a professional do it.
Oh yes, that
because they know what they're looking for.
Listen to him.
Is that the only way you can get checked?
What?
With the finger?
Yeah.
Touchy. Can you get blood?
There's blood tests as well, yeah, there's blood tests. Blood tests can be helpful, but won't necessarily pick it up really early.
Yeah.
Although, to be fair, it is pretty good. That would be prostate-specific antigen testing, which goes up in a number of conditions, including prostate cancer. There's a number of symptoms. I think probably the scariest one would be blood mixed into the poo. There's a number of other ones, so you can get blood in the ejaculate as well.
Did you call? I don't like that you call it that.
What?
Ejaculate.
Or do you want to go with sperm?
Or semen.
Semen?
Yeah. Well, I guess
ejaculate is the technical word.
Yeah.
Yes.
Yes. I don't think semen is the technical word, but I could be wrong.
No, it's just more of a personal preference.
Okay. Apologies. Yeah. So
don't apologise. I think I'd rather hear your wording than Tonye's sometimes.
Difficulty urinating very often, but then usually struggling to actually get the flow going.
Flow, yeah.
Yeah, so flow difficulties is a common one. When it gets larger as well, you can get constipation.
Yeah.
And in the textbooks they described a crescent-shaped feces as well, but I've not actually clinically ever seen that.
I don't think anyone really would probably have to.
Yeah, instead of being like a round, cylinder, it's crescent-shaped. That's the sort of more specific stuff around the prostate. But then you've got to remember there's also other little symptoms that can give you a giveaway as well.
Oh yeah.
So if your appetite's going down, you're losing weight.
Oh yes, of course.
Your sleep is either sleeping a lot more or a lot less than usual. In combination with any of these symptoms is concerning and needs to be looked at as well.
Okay.
I think key is in combination, guys, because a lot of people be like, oh my God, I haven't been sleeping well. And Dr. Blake, who is very vast in the prostate discussions, has said, so I think, guys, it's important to kind of get it all in context. And if you're ever worried, always just come in and get it.
Yeah. And to be fair,
and chat.
Poor appetite, lack of sleep, and some of the other symptoms, weight loss, these can all be symptoms of mental health as well.
Yeah.
They're not in context with everything else going on. If there's no other symptoms and you are feeling, outside of your normal in terms of your mood or anxiety levels or whatever it is, well-being, then those are common physical symptoms that we see. Is poor sleep, both increased sleep generally in depression and reduced sleep generally in anxiety and stress.
The other thing that I think I have been seeing a bit of, and I'm pretty sure you may have been seeing a bit of, and it's on social media, everybody's talking about it, every young guy is, and they're quite young, asking about testosterone.
Yeah.
And there's a craze going on with younger men.
I'm keen to hear about this craze. I miss it. I don't know what you guys are talking about really.
Enlighten us.
Yeah, so there's a lot of younger men are seeking testosterone supplementation, which is obviously it's a hormone. It's basically the man hormone. It gives us all our secondary sexual characteristics, beard, and then down there, it's what makes phenotypically or physically a man more manly, and it has other jobs as well, like it has things to do with your libido. It has things to do with muscle, which is like people do in the gym. It helps to improve mental health.
So the craze is that they're wanting
it.
They're wanting more of it.
Yes, and
it at all. Right?
Yeah,
okay.
They're wanting more of it because they've heard that it does things to them. You're seeing a lot of, oh, my libido is down. Oh, I want to grow muscles. Oh, so I feel like there's a lot of, now more than before, wanting supplementation, even though their testosterone levels itself is actually okay.
Yeah, and I think that's the key, right? Is there a problem? Now, I think generally across the board, globally, we are actually seeing decreasing levels of testosterone amongst men, which is an interesting observation.
Yeah.
And I'm not sure, I'm not aware of any peer-reviewed evidence as to exactly why that's happening. Yeah. There's some theories out there, but nothing concrete from what I gather just yet. And that comes with a few implications, including to mental health. It has been linked with poor mental health and increased levels of anxiety, as well as decreased levels of libido and depression, increased levels of depression. So that's possibly where some of this started from, but then there's still a large number of people who have perfectly normal testosterone, and in those cases you shouldn't really be adding anything extra on top.
Yeah.
It's tempting when people hear there's a lot of misconceptions. You take testosterone, your muscles get bigger,
and there's no evidence really. Just they say lean muscle mass by like 10% or something.
Yeah, it's not.
You're not gonna be raking it in the gym, buddy.
And to be fair, people have taken steroids for those particular reasons, like muscle mass, for a long time, and there's good evidence that can be very, very harmful long term as well. So, with anything you're putting into your body that does not come from you, if it's not done for the right reasons, it comes with risks. And in many cases, I imagine it actually won't make that much difference.
And I think a lot of them is more, and what I think a lot of the zoning is on libido.
So that more than
most, because they know if they want big muscles, they know that that's probably not going to do it. They go for the industrial steroid. And the mental health part, they usually want to get either antidepressants or stuff. So when people are generally asking for the testosterone, it's because they're like, oh, my libido is down, and they didn't realize, look, there's other factors. Maybe you need to stop watching all that porn. Because there's a lot of that plays into why you're not your 20s.
Naturally.
They're all in their 20s, 30s. You never see the older people. It's never the older people wanting that. So that's important, guys, to just be aware of that.
Craze of the time as well, right? You go through ebbs and flows in society, and this is the current
flow.
I think is a good way of putting it. Libido, porn is probably far more harmful to that than
anything else. Desensitization.
And there's benefits like I don't want to completely bash on it, because there are some benefits, in terms of reducing testicular cancer risk with regular,
So you say there's risks, there's benefits to porn.
No, I mean,
I didn't know we had moved on.
No, sorry, I'm talking about.
I was like, wow,
There are benefits
I
out
was like,
there.
wow, you flipped that script. Even I'm shaking in my seat.
No, I'm just saying that there is some benefits with self-fellatio, and if you can ejaculate more than a few times a week, it helps reduce the risk of testicular cancer. I know you don't like that word, but
it just means that I'm never going to get testicular cancer.
yeah, well,
You've given me such good news.
No, I can't guarantee that.
Yay! The next thing I was going to ask you, which is about body image and things like, because again, with this porn that people are watching at younger ages, there's fit 6-pack, 10-pack guys, and there's sort of this niche idea of what sexy is, and guys are just may not understand that actually is playing a role in how you perceive the world and how you perceive the reality of life and sex and things like that. So body image, women have it more, but guys.
Well, I think we're going through a bit of a change in social norms here, actually. I think traditionally, yeah, absolutely, body image has been a massive female problem. Lots and lots of anorexia and mental illness as a result of exactly that. And I think certainly into the 2010s, even towards 2015, I think that was still the case.
Yeah.
But more recently, I've noticed, I'd probably say a fairly even split between eating disorders between young men and young women, and I don't know if that's represented in evidence. I've only seen that anecdotally enough.
I would agree with that.
Yeah.
As well.
Yeah, and at quite early ages, and I think it's because of the easy access to social media. There's a lot more. What would I say? Male influencers who are pushing beauty standards more than it ever used to be.
Definitely.
Facial products, surgeries. Muscular structures that you have to adhere to be good looking, right?
Exactly. And these things are not, those things that you're seeing are a very small percentage of what the world is. So when you're seeing all these people, it feels like every time you're swiping, everybody is muscular, and it's not everybody. It really is a tiny proportion.
When you scroll through Blake's Instagram,
I haven't seen the inside of a gym in a while, which is bad because my heart will not be doing really well. But
I'm sure it is.
We can do an ECG.
Yeah, you exercise tolerance test. I'd die out in barely a couple of kilometers probably.
Between mental health and physical health, it's very, very important, and it's really. I'm actually a little bit starstruck right now listening to how you speak about it, and
he's quite a great speaker, isn't he?
Yeah, no, just your knowledge, and maybe I'm just used to hearing Tonye share his knowledge.
You say semen instead of ejaculate.
Yeah, like just the lingo, like the way you're articulating these
he's very good
actual words. So it's really good. But on the flip side, the societal side of men's health, so masculinity. What does it mean to be a man today, and your take on it? Obviously, having Blake in the studio today and hearing your points of view and what have you, it's always nice to hear someone who is so knowledgeable about it all from that societal side. Like, what are your thoughts?
I mean, my thoughts might be a little bit different to most, just because I've spent a lot of my life traveling around the world, so I've got a lot of different influences there. But I think masculinity traditionally has always been strong, independent, the carer, and the supplier of what would you call it?
Sustenance.
No, the provider.
The provider.
The breadwinner.
The breadwinner, that's the one.
Yeah.
The breadwinner. So that would be, I would say, the traditional description of masculinity. But I think masculinity today probably does have a little bit more caring involved in it, certainly with my wife, there's a lot more expectation to be open and to be involved in a lot of housework and support in terms of the day-to-day. My wife's working. That never used to be the case when all these traditional ones were over, and that's fairly normal these days. So no, I think masculinity these days should be veering more towards just being a helpful helpful, nice human being. And and trying your best to be loving to your people around you and to really treasure the people around you. And I think if you can do that, you'll probably find happiness much more quickly than if you are focused on being outside image.
What about I'm going to give you an example right now. So men who paint their nails, say. What do you think about that?
I think it's really cool. In fact, I would love to get black painted nails.
Like I would. The emo in you.
I would love to do that. But no, I think it's cool.
Like the self-expression.
Because it's more common these days, right? I think a lot of dudes who don't like that look are quick to jump on when they see that and judge instantly. I find that really sad that they're being judged because if they want to paint their nails, paint your bloody nails.
It shows in those cases, and I think always when you see somebody who's very quick to judge, that usually is conversely a representation of an insecurity.
For themselves.
Yes, that's correct. And I think, if you want to paint your nails, that doesn't adversely affect that other person's life whatsoever.
Exactly.
So
and it's that self-expression, and a lot of times maybe because they have been brought up to think a certain type of way. So they may not actually generally know why. It's like, why? You ask if you ever sat down like, why do you not actually like that? Like, do you have any concrete reason? They never do.
They never do.
And that's a key sign to let you know, okay, maybe I need to introspect a bit and realize, why does this bother me?
I mean, humans are always, we're sort of hard programmed to like what we know and to fit in. And so if there's anybody who doesn't meet that cookie cutter approach, then our immediate reaction is to reject. And I think that can be overcome. If you are aware of that behavior, it's very easy to overcome that behavior and look at something and go, and maybe I'll just ask them about it instead, rather than just be immediately judgmental. But that takes a little bit of
time and
onus on the person.
A lot of unlearning as well,
And I think the more you understand your own personal shortcomings and strengths, right? You need to know both. Then it becomes easier to accept other people for who they are, and also address any biases that you may or may not have from childhood.
You touched on it before about the gender roles. Historically, the older generation was a lot different now. So I'm quite glad that you. It's so nice to hear that you have that equal household. Where
I love how excited Hoana is getting. Like you're cleaning, hey.
You help around the house.
Glad.
She might not 100% agree with that, and to be fair,
you're making an effort.
It's not quite 50-50, but then we have different work life, we have different stresses.
Totally.
Stuff. But we try and help out as much as possible.
And she feels supported. That's really what it is. It's not necessarily just
this is your list,
because there are some guys who like doing that. And there are some girls who like doing that. That's why there's families now where the guy would be like, I would be at home taking care of the kids.
I know a few.
She would go to work and
house husbands.
I would, but that's my dream. To be a house husband.
Got to do that hustle.
What else? There's not really much hustling there. It's really not. When you think about it. But that's my dream, anyways.
Okay. Well, good luck with that.
Good luck.
Thank you.
You're welcome.
I'm feeling
Send us a postcard
today.
when you find it.
Hopefully I can just deliver it to you. It shouldn't be too far away, hopefully. Cute.
So were you raised in a house, Blake, with that? What was the gender roles for yourself, like growing up?
Quite strange, because my dad was into manufacturing. So he went all over the world following manufacturing trends, away from Europe into North America and then into Southeast Asia and Asia. So I've been all over that. And I would say because of that, my dad was often not there. And he would just fly back every now and again. And then mum was there as the primary caregiver. So my mum did a lot of DIY and stuff and cooking, but stuff that wouldn't necessarily be considered traditional from a female perspective. and then I went to boarding school.
Oh, yeah.
So you're such a strong, independent woman.
Yeah.
Oh, I love that.
Yeah. Now parents are back in New Zealand and chilling out together.
Nice.
They've retired, which is nice.
Oh,
Yeah, and they've sort of fit into more traditional roles now.
Now that they're at the end of the
End of
the career.
End of the grind. Yeah.
End of the grind. Very
Cute,
cool.
Blakey.
Yeah.
So, I mean, obviously, I love that we've had all the chat, and obviously there's more questions. I'll show you guys how to get straight to Blake, but obviously drop us some info, just send us a text, send us a message, DM us, slide into our DMs. But obviously this has been very, very informative and very serious, Blake. And I feel that people have known your dense and immense knowledge. I wanted to know a little bit more about you.
Okay.
And that's why we go into this segment called Would You Rather? Are you ready?
I look
Hoana,
forward to
tell him the premise of this.
Well, so
fun segment.
historically, when we have guests, we will do a quick fire round, the yes, no, up, down, in our fun segment. But today, we're going to do the fun segment of who would you rather? Would you rather? Oh, that's right, not who.
I don't know if that's an appropriate game
that's
for Blake to play right now.
Yeah. So we're going to stick
There's
to.
only one answer to
There's
that.
only one answer.
Yeah.
There's one answer. Yeah.
So would you rather? So Tonye's going to hit Blake with the options, and we're going to hear what these are.
Okay.
Go.
Are you strapped in?
I'm ready.
Yeah, we've gone through the beer. So
I've got. Hang on, one more.
Yeah, you might as well want to just polish that one. So, would you rather have to eat dessert for every meal, or never eat dessert again? You have to eat it in every meal.
Oh, every meal. Sweet tooth over here.
Oh, really?
Yeah.
Oh, yeah.
I love it.
Yeah,
So,
ice cream for every meal.
every meal.
Yeah.
Okay.
Yeah.
Would you rather go to Hogwarts or Narnia?
Oh, Hogwarts, hands down.
Gryffindor.
Yeah.
You didn't need a moment to think about that.
No. No, Gryffindor, definitely a big Harry Potter fan. Not as big as my wife, to be fair.
Well, this is I threw that one at you. I was like, oh, would you maybe Narnia? No.
No, definitely Hogwarts. I played Hogwarts Legacy. Amazing.
Which is this a computer?
Computer game.
Oh, so for someone who's like, I do play video games too, kind of. Ish.
It's a swipey game.
Yeah.
Swipe.
Swipe.
Candy Crush, yeah.
It's so easy. Just swipe left all the time. Would you rather mentally never age or physically never age?
Physically never age. Oh, yeah.
You stud.
Yeah. No, I'd rather just, live forever. Yeah. Be
And
great.
remain a stud.
And I get older and more experienced.
And you're like literally, but you will still be physically Blake.
No, my brain will get older, but my physical self is fine. So.
I like that.
Yeah.
Would you rather watch dramas for the whole of your life or comedies?
Comedies.
Oh,
Yeah, definitely. I'm more of a comedy film
I would
person.
have. I would have literally picked you as like a dramas kind of guy.
I mean, I like rom-coms, so it's probably my favorite.
My least.
Really? Oh, I think Love Actually is like one of the best films.
Oh,
ever.
yeah.
Is it?
Every Christmas.
What about the Notebook? Koana loves that.
Notebook's
No,
okay. I like Holiday.
Yeah. Oh my God, I love that too.
I like Holiday. Yeah.
I don't know what that is. There's a lot of movies that I have not. I know. There's a lot of gasps with the one. Every time I haven't seen that. She's like,
But then my better half loves horrors.
I love horror.
Oh, yeah.
I knew Karen was for me.
Yeah, she absolutely loves horrors.
I love a horror, but not as much as I used
We watched
to.
one last night, which was Crimson Peak.
Oh yeah.
Oh, it's actually quite
old?
artistic.
It
I
is
like
very
it.
artistic.
I like it. Yeah, I
Is
like
it
it.
old?
It is. It's a little bit older. Yeah. Would you rather?
Here it comes.
Yeah. Would you rather wear someone's dirty underwear or use someone's dirty toothbrush?
Oh, definitely underwear, and I think that's a story about toothbrushes. Which I won't repeat here. I'm good, thanks.
Yeah. Oh, yeah. So which was it? Sorry, I didn't catch.
Underwear.
Oh, okay. So you wear the dirty
Yeah, I can
underwear.
live with that. Yeah.
Would you rather live in Antarctica for a year or in the Sahara Desert for a year?
Oh, that's a good question. Do I get to ask questions, or do I have to make an answer?
I mean, if you have a question, just let me know.
Okay, so like, is it like Antarctica? No, sorry, like Antarctica, but I'm in like a research station and I have big hoodies and there's warmth.
No, you're literally in an igloo.
Okay.
With a polar bear outside.
Okay, and then the Sahara Desert, no access to aircon,
You're
right?
yes, you're literally have a camel that's spitting.
Okay, I'll take the Sahara Desert. I prefer heat.
Really?
Yeah.
Blake, that is really.
Yeah.
It's very un-English of you.
I know. Well, it's because I didn't spend most of my life.
I love it. You're shocking me today, Blake.
Yeah,
First of all, you're like, so essentially you're like a stud who likes
Who lives
the
in the
heat.
Sahara.
I wouldn't use those terms.
I did.
Okay.
And then like last question I have for you, Blake. Would you rather, I almost feel like I know the answer to this one, but would you rather wear one color every day for the rest of your life, or you have to wear all 7 colors every day for the rest of your life? I put this one on for you, kid.
One color, definitely. Yeah.
Yeah.
It's blue, and more blue. Yeah.
Oh, really?
Yeah.
You like
He loves it. It's very, very
It's blue or
monotone.
black. Yeah. Blue or
Okay.
black. That's pretty
You have
much
no
And you
colour.
like grey too.
it. I like grey too.
Yeah.
Yeah. Come on, I'm not a heathen. Yeah.
Yeah. Like one extra color, that burst of life there.
Just add a touch of grey.
Yeah. You can't go wrong with grey. It goes with everything.
It does. Awesome. Oh, yay!
Awesome.
Thank you so much.
All right, you guys.
Well, thank you so much for joining us. We've
Yeah.
really, really appreciated it. There's
It's been
probably
fun.
so much more that you would want to touch on. It is hard to always squash it into one episode. But if you do have any questions, as Tonye mentioned before, with regards to men's health,
Yeah.
please, send them in and we can. I probably won't be able to answer them, but
But
we'll make
even
sure.
if I can, I will definitely
Yeah,
forward
we'll
it on to Blake
Yeah.
as well. And just the sign off thing from a wrap of everything is just basically, I suppose, what would you say? Like, guys, check your prostates.
That would be your one tip.
One tip. Okay, take home. Keep your friends close. They will help you through the toughest times.
Yo,
Sure.
Mom, I love that, Blakey.
Yeah.
Yeah.
Yeah, I love it. It's
Yeah.
so good.
So you heard it here.
Here first.
Awesome.
Thanks
All right,
again. Don't
thanks a lot,
forget to
guys.
subscribe, and we'll see you next time. Sayonara.
Bye.